But I think very closely related to that will be innovation and technology, which then brings me to Anna. In your role as an innovation ecosystem builder, could you share your thoughts on how innovation and technology can be effectively integrated into the Nigerian public health space? We've been talking about data. We know how closely tied to data those two are. How can we leverage innovation and technology effectively to enhance the impact and sustainability that Sydney was just talking about? If you don't mind, could you provide examples from your work in other spaces?
Thank you. Hello, can you hear me clearly? Oh, fantastic. Okay, yes, I mean, I've particularly enjoyed the contributions from all the panelists here. And all that has kept resonating in my head is everything that's been spoken about, whether we're talking about the talents and the resources for the healthcare systems, or we're talking about data, or even access to maternal health, or strengthening the integrated health systems. What comes to my mind is technology can be used to scale these efforts, right? So I would say one, technology for access, right? It can even solve this problem of people leaving, right? So the fact is, where we are today, we have a large percentage of our talent migrating out of the country, right? It's not good for the country in terms of, the constant reduction of the ratio of primary healthcare workers, doctors and the likes to the population, right? So how can we leverage on technologies and innovations such as telemedical tools, for example? So we have telemedicine and mHealth solutions, right? And we have quite a number of them across Nigeria. And right now they're doing a fantastic job leveraging on mobile technology, leveraging on mobile phones, leveraging on mobile apps to actually provide access to healthcare advice, provide access to the latest healthcare facilities and the likes, right? So it solves two main problems. First, we have people in remote areas that do not have direct access to primary healthcare clinics. So whether we set them up, equip them and the likes, are they accessible? Are they close to the people that need these healthcare, right? Yes, not everything can be solved over the mobile phone, we know that, but a lot can be prevented, or a lot can be mitigated even before they get to the point of reaching the primary healthcare facility, just by accessing their mobile phones and accessing a service which some are as little as 500 naira, for example. I know that's still expensive if you really look at the remote areas, but there are ways of funding these, and this is where insurance comes in as well. So I would say, even talking about insurance, we need to consider integrating telemedicine and mHealth solutions, for example, into the insurance system. And one of the health insurance providers did this actually during COVID, right? Because the movement was restricted and all that, and they actually introduced an mHealth solutions that people that were signed on to the insurance packages could actually access doctors remotely. So the question is, how could we bring these people back? Maybe not physically, but people that have been trained here, people that have practiced here, people that understand the Nigerian healthcare systems and understand how to treat Nigerians in a very practical way, but have left. How can they still contribute to the knowledge, to providing support to people even here, right? How can they contribute to the data analytics? How can they constantly contribute to work that has to do with strengthening the healthcare system? Another thing that I would say, which is very important for technology, is, again, we've spoken about it on the panel. Dr. Fulani and Mr. Sydney said a lot about data-driven decision making. Like, this is super important across board. Like, in the technology and innovation space, we sleep, breathe, and talk about data driven decision making. You need data for effective policy making, you need data for effective program design, you need data for effective investment, you need the data to tell you the returns of your investment and if it's actually worth it, right? Whether it's investment in terms of monetary returns, or whether it's impact, right? Returns on impact. Now, when we look at technology such as electronic medical records, or you could also say electronic health records, right, EHRs or EMRs, we need to prioritize that, right? The current government needs to really look at ensuring that, one, health records are digitized. When you work into a lot of hospitals, even the ones in the cities, you know, the prescriptions, the medical records are still written by hand, paper, basically. And they're not digitized, so we need to digitize that. Now, after digitizing the individual medical records, and the hospitals itself, right? And it's not just about individual medical records, it's also about the drugs that have been used. It's about analyzing the data or prevalence of certain diseases or medical situations in particular regions. How can you now integrate all the digitized records, right? Because we also have to talk about mobility, even within Nigeria, right? Mobility between states, mobility between rural areas and urban areas, and vice versa. And the fact is, even if you have a hospital and it's fully digitized, fully high-tech, and you move to another location, it's a pain to access your records. And that could be the difference between life and death, literally. There are people that have, you know, had medical emergencies. They were not, what's it called? Yes, they couldn't, they were not, yes, and all that, and they were given either the wrong diagnosis or the wrong blood transfusion or all of that. You know, all that could have been avoided with an integrated medical record system, right? So that's important. People should be able to access their medical records at any time. People, and even now with, you know, IoT devices, you can connect that with a device on your wristband, for example, especially if you're high risk, you know, whether you're diabetic or have any other high risk medical situation. So that's another thing for data-driven decision making on the primary healthcare, on the individual level, on the primary healthcare level. And also on a state and national level and all that, because this can also be used for prevention of outbreaks, because we don't need to get to the point where it's on a critical mass and people are reporting it before you see a trend in a particular disease that's happening, and then you can curtail it. But this has to do with data, and technology can basically drive this. When we look at technologies like artificial intelligence, for example, data analytical tools, even geospatial technology, right? We see the use of geospatial technology in agriculture, for example, mapping of, you know, soil types and everything, but that can also be used in connecting, making data-driven decisions in terms of even mapping out where to prioritize health system strengthening, right? Just by population type, right? Or even developing a heat map in terms of, you know, the spread of a particular disease outbreak. So that's quite important. Then another thing I'd say is technology for education, right? We spoke a lot about maternal health, reproductive health and the likes. Now, at the moment, we're currently carrying out a project with UNFPA, and it's focused on identifying innovative solutions and technologies across 5 African countries that have to do with the prevention of female genital mutilation, and also education and access to products around reproductive health, family planning and the likes, right? And we've seen some really interesting innovations that have come out of, you know, young innovators that are building these solutions. Everything from, you know, a platform where people can actually access products anonymously, you know, because again, you know, Dr. Marta spoke about the culture and everything. So how can we create a system whereby there's trust? You know, you can actually access through a platform or making a phone call. You know, Professor Sambo talked about the call centers and all that. How can we use technologies to drive all this? So it's basically about, technology is a tool to scale your efforts, whatever you're doing. How do you scale? How do you analyze? How do you increase access to markets, right? We talk about drugs. Professor Sambo also spoke about branding the drugs, right? Because people don't necessarily trust the unbranded drugs. We called it the generic drugs, exactly. And we have technologies that deal with digitizing the distribution of healthcare products. right? And you're doing quite well. Now, on the plus side, and this is where the government comes in, we need the right policies to enable these innovations and technologies, right? We need pro-innovation policies like tax breaks, for example, right? For example, at NIPC, we have the pioneer status. How can we extend this to healthcare innovations and technologies and products and the likes, right? We also need infrastructure. So broadband connectivity, right? If we're talking about providing access to health information and treatment and advice and education and all that, and distribution of drugs and equipment, but people are not connected to the internet, then they are going to be shut out, right? And that's something we saw again during COVID. So during the pandemic, this was in 2019, we actually carried out a project called COVID Action, right? So we worked with the likes of FCDO, the UK Disability Hub, and a couple of other international partners. And what we did is that we focused on identifying and supporting innovative solutions around 4 areas. So one was local productions and local solutions. So identifying the local production of products such as, PPEs and the likes, which we all know was, scarce during that period. One was focused on technologies that drive data, analyzing data about the pandemic, about the challenges around, all of that. Resilient health systems, right? So technologies that actually strengthen the relationship between the individuals, the households, the health facilities and the government as well. And then the last was Oxygen Collab, right, which had to do with the unavailability of adequate, oxygen. And some of the challenges that we saw is, one, because of the shutdown of places and also the shutdown even of, internet facilities and access and the likes, we had to take it offline. Basically, it was sort of like an offline program. And we went to the raw areas and found people that were actually developing these solutions, right? But there was a problem of trust, right? And that's a general problem that we have to solve, taking a multi-stakeholder approach. Ensure that the people you're designing for, the citizens, wherever they are part of the process from the onset. That would save billions of dollars in investments. No jokes. We have poured in millions of dollars into a product, and at the end of the day, people were like, no, it's not going to work. Our culture doesn't align with it. The technology doesn't align with even our broadband, even those that are connected to the internet speed doesn't, catch up, match with the technologies and all that. So that's very important. Then lastly, I would say invest, right? So invest in 2 things. Invest in the technologies, because typically health technologies are usually one of the least to be invested in, unfortunately, right? So we have the fintechs and the logistics tech and, all the other technologies that have all the attention, right? But health is usually seen as a public service, and as such, the private sector don't invest as much. They do, but not as much. And I'll give you an example, even in terms of the inequity, even with the investment. A study that was carried out on distribution technologies for products, health products, found that over 70% of investment that went into that sector in terms of the technologies in that space across 4 countries went to 4 companies. 4, So what happens to the other ones that are doing fantastic work? And I will tell you from experience also as an investor that those 4 companies were, yes, they had fantastic products and were doing well, but there are so many other factors. The founders had connections with the investors, they said the right things, they spoke the right things, they were in the right cities and all of that, right? So with AfriLabs and our work across 52 African countries and over 200 African cities, we're constantly advocating for investment to be equitable and to spread across, the cities. And the only way that can happen is through government intervention, right? So one of the funds, for example, that the government has just set up, IDICE, right, which is a program focused on funding tech startups and creatives, right, is a partnership, right, between the government, development organizations like the AFDB and the likes, and also the ADB, and also the private sector, right? And that's an example of a multi-stakeholder approach that can actually drive investment into a sector. So if the government says, you know what, you're going to contribute a percentage of the GDP to, or a pool of funds, to investing in healthcare innovations and technologies, right? And we want the private sector to bring an amount, right? And then jointly own equity in that system, which can be successful in terms of returns on impact, investment within Nigeria, but can also scale to other African countries, right, and to the world. Why not? We can innovate for the world as well. So these are ways that can drive investment into the solutions. And the last is invest in R&D. Mr. Sydani touched on that as well. I would say bring universities into this. You know, one of the things we're doing, for example, as AfriLabs is we're connecting universities to the innovation labs that are part of our network and building a system whereby every student that goes to school, right, from their penultimate year, that third year, going into fourth year, they begin to identify a real problem in the society or industry, right? And this is a problem across the board. Our students are not developing, carrying out their research on real life solutions, right? Some are that are guided, but majority, the curriculum doesn't necessarily force you to do so. So how can we create a system whereby every project, you know, from your third year when you start considering it, your supervisor guides you to start identifying solutions. So all the medical, health, biomedical, you know, every related course, for example, and even non-related course, because you can be studying MIs, for example, management information systems, and still innovate for the medical sector. So how can we identify what the challenges are? Again, data-driven. So the government needs to step in and say, these are the challenges we have across Nigeria. Okay, students work to innovate it. Then you connect to an innovation lab that can help you develop the system. The industry comes in, right? The big corporates and companies, and you know, some of them that Professor Sambo mentioned that already have the experience and technologies, and everyone joins forces and, you know, with the government and see how they can solve our solutions. We have all the solutions within us. We do, right? But we need to be data-driven, we need to invest, we need to put the right policies and infrastructure in place and, you know, work together. So that's it. Thank you.
Wow, thank you so much. Thank you. And for sharing all of your experiences.